Welcome to the Sibo Doctor podcast with Dr. Nirala Jacoby, a US-trained naturopathic physician and medical director of the Sibo Doctor, an online education resource for practitioners. This podcast is intended for Sibo treating practitioners and aims to help educate how we may best serve our Sibo patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to Sibo and associated conditions. Head over to thesibodoctor.com where you can learn everything about Sibo from the basics to advanced treatments. You can also join in the conversation on the Sibo Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the Sibo Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacoby and the Sibo Doctor podcast.
Welcome, Sibo practitioners, to another episode of the Sibo Doctor podcast. With me today, I have really the great pleasure to talk to Dr. Kate Broderick, who I was in attendance of the Australian Naturopathic Summit when she did a very riveting lecture on hydrotherapy and had the entire audience just amazed at the capability of what water can actually do and how simple it is to give your patients instructions with water treatments. It's a very, very old naturopathic treatment. And so I thought I'd have her here on the podcast to talk more about how we as practitioners can incorporate some of these very simple techniques into our practices. Dr. Broderick is also a graduate of Bastyr University, like myself, and is an educator. She was the Director of Education here in Australia at one of the universities, at Endeavour University, and is now in Adelaide, where she has a center, the Anam Chara Health Center. And it's my great pleasure to welcome you here, Kate.
Hi, thank you, Nirala. Great to be here.
So let's dive right in. First of all, it was one of those passionate things that I really wanted somebody to talk about hydrotherapy at the ANS in August last year. And you just completely over-delivered what I had wanted in that program. And it was just amazing to see the response from all the naturopaths. Can you kind of just start with talking a little bit broadly what hydrotherapy is?
Sure. And hydrotherapy has been lost a little bit from the Australian naturopathic landscape. It is really the foundational therapy of historical naturopathy. And in the modern day, it's become a little bit pushed to the side, but it's experiencing a little bit of a resurgence around the world. And I'm happy to participate in helping to bring that back as a therapeutic modality in naturopathy here in Australia. The tradition is very strong and very old. You'd be very hard pressed to go back into history of really any historical culture and find a culture that didn't have a therapeutic use of water. But ours comes from Germany in particular, and that's where the roots of naturopathy sit. And I first became enamored of naturopathy when I was a student at Bastyr and had my first hydrotherapy training there, and then was one of the leaders of the Nature Cure Club at Bastyr when I was a student for a year or two. I can't remember exactly how long that was, with some other really wonderful folks there. And we just really sunk ourselves into it quite a bit. And moving on from there, I had some mentorship from two wonderful elder naturopaths in the U.S., Dr. Nancy Welliver and Dr. Kathy Rogers, both of whom use hydrotherapy integrally in their practices, and followed along in their footsteps in trying to install that within my practice to the greatest extent possible. And I've also had some training in Germany just a few years ago in Germany at the Kneipp Institute. And you might have heard the name Father Sebastian Kneipp we went to Bad Wiershofen, where he used to practice he was a priest in the Catholic Church, but he was also a hydrotherapy practitioner and really is responsible for the development of naturopathy as a profession, the grandfather of naturopathy. And we went and studied hydrotherapy in Bad Wiershofen at the school that is still running there, that is continuing to perpetuate hydrotherapy as a root wellness support to the population in Germany. So that was a real special experience to get to experience that history and how it's been brought up into the present in Germany.
That's great. I mean, growing up in Germany, I certainly know the name Father Kneipp long before I ever came to Bastyr University. And also in my training, and to this day, I still use a lot of hydrotherapy in my practice, whether that's ear infections in children. We know the warming sock treatment. We have alternating hot and cold applications of water to stimulate healing in different parts of the body. And I just thought it would be great if we can dive a little bit into specific treatments and how they relate to digestive health, of course, and what we can do at home if you're a patient actually listening or somebody who has digestive disorders can maybe try some of these techniques out, because it is one of those really powerful self-help treatments that you can do on yourself.
Sure. So it would probably help to lay a foundation first of talking a bit about the way the physiology in the body works in response to hot and cold water. Because if you don't understand the physiology, then it's a real mystery why it is that putting your feet into hot and cold water is going to help your digestion, but it does. And so talking a little bit about the background of that physiology, the basic premise of naturopathic hydrotherapy is to stimulate the body's homeostatic mechanisms. It's essentially using hot and cold water, or sometimes just cold water, to push the body slightly off balance. And when the body is pushed slightly off balance, then it has the opportunity to correct itself. And it corrects itself through all of the homeostatic mechanisms that we have, that we know, that keep our body at a normal core body temperature, that keep our blood at a certain pH, and all of the other things that go into our homeostasis. And the way that that's accomplished through the physiology is the temperature receptors on the skin send a message to a couple of different places. They'll send a message to the spinal cord, and there are some reflex arcs that happen through the spinal cord in response to temperature change that have some results. And then it also sends a message to the hypothalamus in the brain. And the hypothalamus is sort of the central controller of our homeostatic mechanisms. And then there'll be a whole another set of effects that happen from that stimulation to the hypothalamus. And so all of the effects of the hydrotherapy treatments are mediated by the nervous system and the cardiovascular system. The main effects on the nervous system are to create this sort of, a back and forth effect between the sympathetic nervous system and the parasympathetic nervous system. Now, anybody who's ever been into shocking cold water could probably predict that a shocking cold treatment is going to stimulate the sympathetic nervous system, which is our fight or flight. It's a stress to the body. Our body perceives cold as a stressor. And then hot water, you can imagine sitting in a nice warm spa, how stimulating that might be to the parasympathetic nervous system. And so as we kind of work back and forth between the parasympathetic and sympathetic nervous systems with these stimulations of hot and cold, the body sort of trains itself up to a better balance between sympathetic and parasympathetic dominance. We know as we're walking around in our culture today that we're almost always stressed out, right? And we're almost always then working in sympathetic nervous system dominance. And if we're hanging out in sympathetic nervous system dominance, then our digestion doesn't work well, because digestion happens during rest and digest, which is parasympathetic dominance. And so always, if you can train the body into a better balance and being more accustomed to coming into parasympathetic dominance, then we can achieve better digestion because we're spending more time in rest and digest. And a friend of mine gives the analogy of hydrotherapy repeated on a regular basis over time, and we'll talk about some specific treatments down the track here, will help to sort of train up the nervous system. And it's like taking the autonomic nervous system to the gym. It's giving the autonomic nervous system a little bit of a workout so that it is toned up better and it knows how to control itself better. And then we have the circulatory aspect of things. Hot and cold water through the mediation of the nervous system is going to change blood flow to different areas of the body. So hot water will tend to create vasodilation in the short term. So that's increased blood flow to a certain area. Cold water will tend to create vasoconstriction in the short term to a given area. And so we can control blood flow through using hot and cold water. And as we control blood flow to different areas, we can also stimulate certain functions. And this is how we can also influence the digestion very positively. When we are in sympathetic nervous system dominance, we don't have very good blood flow to all of our gastrointestinal organs, as well as all of our elimination organs. And we know how important elimination is to maintaining health. We need to have the liver working properly. We need to have the kidneys working properly. And we need to have the bowel working properly to eliminate the things that need to be eliminated. And so if we can stimulate blood flow to all of those organs, including all of the stomach and the small intestine as well, to aid digestion, then everything is working better. The level of vitality will rise, and we will get better digestion, better assimilation of nutrients, and better elimination of waste. And so we can do all of this just through using hot and cold water, which is pretty astonishing when you think about it. And one of the beauties of this treatment is that it completely relies upon the body's innate capacity to organize itself towards healing. So this is a true naturopathic approach. It is stimulating to the vis medicatrix naturae, and it is completely reliant upon the vis to provide whatever correction and function needs to happen in whatever state of imbalance the patient is in. And so as long as the treatment is well prescribed in intensity and in the areas that are being stimulated for the particular patient, it's going to send them in the right direction, generally very gently and very slowly sometimes. It's something that sometimes takes some patience to sit with for a while, and it takes establishing new habits as well. And so any questions about that before I talk about some more specific treatments?
No, just a comment about so the circulation is improved, the autonomic nervous system, which we talk about on this show a lot because there is such a connection between what we call dysautonomia, or a dysregulation of the sympathetic and parasympathetic nervous systems are very much related for many people with Sibo and other digestive disorders. So I think this is such a great aspect of something that's so simple and so elegant can have such a great effect. And you don't have to necessarily use supplements or other external products to affect this change. The other one is also the lymphatics, right? The lymphatics are also moved, circulation and neurological activity. So it's this whole package of effects that are that we're seeing with hydrotherapy, right?
Absolutely. Anytime you're improving the circulation to an area, you're also improving the lymphatic flow in that area. And certainly the lymphatics and the immune function within the gut are two very important components of this. It's worthwhile to say that particularly cold stimulation following hot is very stimulating to the immune system as well. And it will increase the circulation of white blood cells and help to generally stimulate the immune system. So if you have a dysbiosis going on, whether that is SIBO or whether that's dysbiosis in the large intestine, that is also going to be assisted by these types of treatments very gently.
Great. So let's dive into some of these treatments. Would it be easier if I give you some case, not a case, but like a situation, or do you want to generally talk about the treatments first, and then we can maybe specifically talk about somebody with constipation or somebody with anxiety, or those kinds of scenarios?
Maybe I could just overview a few treatments that are really easy to prescribe for a naturopath to prescribe to a patient to do at home. Because, most naturopaths these days don't necessarily have an office set up that would lend itself to doing these treatments in-house. And though you may develop a passion for that down the track and reorganize your office, really it can be very handy to prescribe these treatments for patients to do at home. And you also then, assuming that the patients are willing and able to go along with the treatment recommendation and actually practice these treatments, you can get a more frequent treatment going when you can do this at home. So some of the treatments that I prescribe most often to do at home in relation to either just a general stimulation of the patient's vitality or a particular stimulation to digestive function. And those two things really, they go very much hand in hand. You don't have good vitality if you don't have good digestion, and vice versa. And it is almost universally the case that if somebody comes in with poor digestion, any kind of digestive dysfunction, there will be poor vitality that comes along with that. And so the types of treatments that I'll talk about today, I'll start first with maybe the least intensive treatment and the easiest to do. And I'll go on towards the ones that are more time intensive and a little bit harder to do. And less intensive is better for people with lower vitality or less time that they might be able to apply to doing the treatments every day. And the more intensive treatments are better with people whose vitality is perhaps a little bit higher, and you can maybe urge their system a little bit harder. So the first treatment I would talk about is alternating foot baths. And this is probably one of the easiest treatments to do. It is also from a patient perspective, it's also probably the easiest in terms of working it into your day. It takes really about 10 minutes to do the totality of the treatment. It is generally best done right before bedtime, and it gives a really nice relaxation effect going into sleep. And so it can improve sleep along with everything else. And it leaves the patient in parasympathetic dominance where we want them to be going into sleep. And so basically an alternating foot bath is you get 2 tubs of water, a hot tub, and you want the tubs to be big enough to submerge the feet entirely up to just above the ankles, maybe an inch or 2 above the ankles. Or in some cases, you can use deeper tubs and get up to just below the knee. But really, I found that just above the ankles is fine. So a tub of hot water generally would tell the patient as hot as you can stand, without scalding. And some contraindications here or cautions here. If you have somebody who has limited sensation of temperature in their feet or any kind of neuropathy in their feet, particularly from something like diabetes, you need to be cautious with this, and somebody else needs to test the temperature of the water for them and make sure that it's not too hot, because folks with those kinds of limitations are perhaps at risk of burning themselves if there's not somebody else to sort of gauge the temperature of that water. And then the cold water, when we talk about cold and hydrotherapy, a lot of people think, oh, cold water, I don't want to do that. It sounds horrible. We are not talking about ice water here. We're talking about, in most places, the temperature of the cold water that comes out of the tap in autumn or spring. In the summertime, you might need to add 1 or 2 ice cubes, or if you live in Queensland or northern New South Wales, you might need to add 1 or 2 ice cubes to cool that down just a little bit. But we're not talking about ice water here. And in the wintertime, you might even need to add a little bit of warm water to it if you're not accustomed to the treatment when you first start out, because the cold water out of the tap in some places in middle of winter. Where I live in the Adelaide Hills, it's too cold for the feet. So basically a tub of hot, a tub of cold. You do 3 minutes in the hot water, 30 seconds in the cold water. You repeat that 3 times. Then you dry the feet off and you go to bed. So if you put on your pajamas before you get ready to do this treatment, you do the treatment and then you go directly to bed. And what this does, why it is that the treatment to the feet will help to stimulate the digestion is because there is a reflexive relationship between the skin on the feet and the digestive organs and also the pelvic organs. So this can be really good for things like dysmenorrhea as well. So if you have hot water on the feet, it will cause vasodilation in the feet, but through the reflex arc in the spinal cord that I mentioned earlier, you'll also get vasodilation in the gut because of that reflexive relationship. And then when you put your feet into the cold water, you get vasoconstriction in the feet, less blood flow, and you get vasoconstriction in the GIT and in the pelvic organs. So we go hot, cold, hot, cold, hot, cold, hot, cold, and we always end on cold. And you'll note that this will be a theme in all of the hydrotherapy treatments, always end on cold. So if cold is vasodilation to the feet and to the gut, why do we want to end on cold? That seems really, really counterintuitive. And the answer to that is that there are direct effects of cold water, which are the vasoconstriction, but there's also indirect effects of cold water. And the indirect effects are the ones that are mediated by the autonomic nervous system and the hypothalamus, which I was talking about earlier. So when you stick your feet in the cold water for the last time, and then you take them out and you dry them off and you go to bed, the direct effects of the cold don't last very long, the vasoconstriction in the feet and in the gut. And then you get the indirect effects, which is the correction that's made by the autonomic nervous system and the hypothalamus. And the correction is bringing more blood flow into the gut, bringing you into parasympathetic dominance. And if you try this treatment, you'll see that within 5 or 10 minutes after going to bed, your feet are very, very warm. And that's because the indirect effect is to, again, create vasodilation through the autonomic nervous system and the hypothalamus effects. So you go to bed in parasympathetic mode, and you've got good blood flow to your digestive organs and your elimination organs overnight, and you get better sleep. It's also really good for reducing anxiety. And one of the reasons it's good for reducing anxiety, in addition to just the general effects on the autonomic nervous system, is because when you increase blood flow to the GIT, we know how much innervation there is in the GIT. The enteric nervous system is intense concentration of neurons in our digestive tract. And when there's not good blood flow to the digestive tract, we get a buildup of metabolic waste around the nerves. We get, if we have Sibo or other dysbiosis going on in the gut, we have a buildup of metabolic waste around those nerves, and the nerves are irritated. And when the nerves in the enteric nervous system are irritated, then the nervous system in general will be irritated, and you'll have a greater chance of having anxiety. So when you have that increased blood flow to the gut, you get an increase in nutrients and oxygen into all those tissues, and you also get an increase in the carrying away of metabolic waste. And that's carbon dioxide and all of the other metabolic waste that goes on when you've got dysbiosis going on, or even just normal metabolic waste that we have from our cellular processes.
That's fantastic. So just to summarize, the foot bath, basically the hot is 3 minutes each cycle, the cold is 30 seconds each cycle, and you repeat it 3 times, ending on cold always.
Yes.
Yes?
Yes.
And is there any benefit for, like you mentioned, that you can get deeper foot basins or plastic basins that you can do this in? Is there any benefit to that, or is it just up to the ankle, the water level enough for this?
So it depends on how intense you want the treatment to be. The larger the surface area that's treated, the more intense the treatment will be. And so if you have someone who has slightly higher vitality, a more intensive treatment might give you a faster payoff, essentially. Or you might have somebody do it with the water to the ankles until their vitality increases to a certain extent, and then they could increase that surface area by doing it to the just below the knee. The easiest way to do that at home is get a couple of I call them 5-gallon buckets because I'm still working in the imperial measurement system, but the big paint buckets.
Yeah. 20 liters, I think, right?
20 liter. Okay. The big white plastic buckets, which are generally big enough to accommodate most people's feet and up to the water just below their knees. And this is sort of mimicking one of Father Kneipp's treatments, which is a knee rinse. And a knee rinse is something that covers roughly the same surface area. It actually is a rinse that is to just above the knee. And it can be done with alternating hot and cold water, just with a handheld shower head if you're really good at it. But that tends to be a treatment that's done more in office with specialized equipment, although you can find instructions on some German websites on how to do that at home if you're interested in that.
Okay, fantastic. So the foot baths are really great for those that have problems sleeping also, so not just digestive issues, would you say?
Yes.
And so any type of insomnia. And what about, I'm just thinking, like in terms of my patients that I'm seeing, is there any benefit to somebody who has, any kind of other digestive issue like constipation, diarrhea, anything like that? This treatment is the same? You wouldn't change anything?
No, the treatment is generally prescribed as it is. This isn't one that's modified very much. The main modifications are, but while you're not used to the treatment when you're new to it, you want to use a narrower contrast of the water between the hot and the cold. Start out not so hot and not so cold until you see how your body responds to it. I've seen some relatively low vitality people have some relatively large healing reactions from doing this treatment, say 3 nights in a row. And so you want to start out more moderate when there is a low level of vitality and work your way up to a greater contrast. But generally, this treatment is very good just as a general increase to vitality for pretty much any condition, honestly. It does have a greater target towards the digestive organs and the pelvic organs. And one of the reasons that it is good for insomnia as well is that there is a tendency to sort of pull the blood flow down to the feet and down into the gut and away from the head, which decreases the activity of the brain ultimately. As does, moving into parasympathetic dominance, it decreases the activity of the brain. And so oftentimes when people have insomnia, it's because they can't turn their mind off. And this can help with that.
Can you talk a bit more about the healing crisis or healing reaction as you mentioned?
Yes. So obviously, let's take an example of constipation that you just mentioned. If you have someone who is constipated and you go in and you stimulate their GIT, particularly if it's been atonic for a while, if it's been denied blood flow through sympathetic nervous system dominance for a good while, and all of a sudden you stimulate it to start moving, essentially, you can have a healing crisis that looks like essentially, now, pardon me for sort of anthropomorphizing the routes of elimination. I do that on a regular basis, but you essentially have the whole of the intestinal organs, the digestive and eliminative organs going, oh, wow, we've got all this blood now. And we've got this sort of balance in the nervous stimulation and no longer in sympathetic dominance. This is a good opportunity to eliminate stuff that we haven't been eliminating for a while. And you can imagine that if you've stimulated the blood flow to the liver might have processed some more toxins and dumped them out into the gut. You might have increased bile flow, and that might decrease, obviously, the tendency towards constipation because bile is a laxative. And you might have a healing reaction that looks like loose bowels or even diarrhea for a while until the body has gone through that initial clearing. If the immediate stimulation is not one of getting the bowels really robustly moving, but you have sped up the liver, you might have a healing reaction that looks like a rash or sweating. or other kinds of discharge processes. And sometimes you can count on a healing reaction that's produced in the gut healing to sometimes show up not only as gastrointestinal symptoms, but sometimes respiratory symptoms. So you can get increased mucus coming out of the upper respiratory tract or even the lower respiratory tract sometimes.
Thank you for listening to the Sibo Doctor podcast. We hope you found the information in this episode useful in the treatment of your Sibo patients. Thanks to our sponsors, SiboTest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the Sibo Doctor podcast. Thanks again for listening.